Hello, and welcome to the Connecticut Region V Paramedic Protocol Medication Update for 2011. We'll be talking about three different medications today. The first is haloperidol or Haldol. The second is prochlorperazine or Compazine. And the third is metoprolol or Toprol, also pronounced metoprolol. Haloperidol or Haldol is a medication that must be used under online medical direction. Direct medical control must be contacted before you administer Haldol. The protocol that we use Haldol under is for psychiatric emergencies, effectively as a chemical restraint. It's typically used in conjunction with lorazepam or Ativan, and in fact can be mixed in the same syringe for ease of injection when actively chemically restraining a patient. The primary indication is psychiatric emergencies with violent patients, of course. Contraindications to keep in mind include brain damage, bone marrow depression, which is a disease state in which the bone marrow doesn't produce adequate red blood cells and white blood cells and platelets, alcohol and barbiturate withdrawal states, Parkinson's disease, angina, and epilepsy. Presence of any of these contraindications can increase the frequency and intensity of side effects or undesired effects of Haldol, which we'll talk about in just a moment. As a medication class, Haldol is an antipsychotic. The average dose, or the standard dose, is 5 milligrams, and it should only be administered IM. The IM sites that you can use to administer Haldol and Ativan are the deltoid, or upper arm, the vastus lateralis, or the thigh area, the ventrogluteal, or hip, or the dorsogluteal, or deep dorsogluteal, the buttock. Side effects include laryngospasm, respiratory depression, seizures, and on rare occasions, a worsening of the agitation of the patient. It is something to be aware of, however. Again, watch for all contraindications which may contribute to the side effects of Haldol. How does Haldol work? Well, Haldol depresses the cerebral cortex, the limbic system, and the hypothalamus. These control general activity and aggression in patients and cause the patient to simply become calmer. It takes about 10 to 20 minutes to begin to work, and the duration of the medication varies depending on the patient and the circumstances under which it's being administered. The next medication that we're going to talk about is Compazine. This can be administered on standing orders under the acute abdomen protocol. Specifically, the indication for this is nausea and or vomiting refractory to oxygen administration. Contraindications for Compazine include hypersensitivity to phenothiazines, of which Compazine is one, coma, seizure, encephalopathy, or again, bone marrow depression. Compazine, as we said before, is a phenothiazine and an antiemetic. The dose for Compazine is 5 to 10 milligrams, and it should be administered deep dorsogluteal IM, again, the buttock area. Side effects for Compazine include drowsiness, blurred vision, hypotension, sinus tachycardia, skin rash, and on occasion, extrapyramidal reactions, usually dystonic reactions. Most common reactions for Compazine include the drowsiness and generalized depression, but keep an eye and continue to monitor your patient once you've administered the Compazine. The way Compazine works, it blocks stimulation of the chemoreceptor zones that cause vomiting. It takes about 20 minutes to start working, but the peak effects really take on at about 40 minutes, and Compazine can last up to 6 hours. The final medication that we'll be discussing today is Toprol. This too can be administered on standing orders. The protocol that we're using it under is the stable tachycardia, where it's mentioned in the American Heart Association Emergency Cardiovascular Care Guidelines. The indications for Toprol include narrow complex tachycardia, stable narrow complex tachycardia in patients that are currently prescribed beta blockers. Toprol is a beta blocker, so again, the indication comes back to patients that we know work well with beta blockers. Also to make note is that it is stable narrow complex tachycardia. For unstable tachycardias, we want to follow the unstable tachycardia protocol. Contraindications for Toprol include a systolic blood pressure that's less than 110, a heart rate of less than 60. Of course, bradycardia, by definition, is a contraindication for a medication that we give for tachycardia. Also, we need to watch out for active COPD or acute pulmonary edema for some of the other effects that Toprol can give. Toprol, as we said before, is a beta 1 selective or cardiac selective beta blocker. 5 milligrams IV is the standard dose for Toprol. Side effects for this beta blocker include hypotension, headache, facial flushing, dizziness, and decreased level of consciousness. How the Toprol works: again, it's a beta blocker, so it blocks stimulation of the beta 1 receptors. This results in decreased speed and work of the heart. Toprol takes about 20 minutes to start working, and it reaches its peak effects in about an hour. Once on board, Toprol will last about 6 to 8 hours. Well, that's it for our 3 medications. At this time, you've completed the video portion. If you have additional questions, you are strongly encouraged to contact, of course, your service EMS coordinator or your local EMS coordinator. Thank you very much, and at this time, you can move on to take your short exam to complete this training program. Again, thank you.